Hey everybody, welcome to the CSUPA program. I'm Dr. Scott Wade, the Director of Didactic Education and the course director for several of the courses that you'll be a part of over the next year. I lead your Diagnostic Sciences course in Unit 1 and the Problem-Based Learning course in Units 2 through 3. If you're curious about what that means, the breakdown of the units throughout the year, I'll explain. With a didactic curriculum, through the first year of the program, it's divided into 3 semesters, which are subdivided into 5 units. The first unit is 5 weeks long. It includes human anatomy and diagnostic sciences. The second unit is going to make up the remainder of the first semester. And that's where the heart of the program really kicks in with your basic science course, your clinical medicine, pharmacology, patient assessment, and diagnostic methods, commonly referred to as PATM, problem-based learning or PBO, and then your path to becoming a PA course. These courses will continue through Unit 3 and then 4, and then in Unit 4, we add the Fundamentals of Pediatric course. To finish the fall semester, there's a 5-week Unit 5 at the end of the fall semester, where the clinical year prep course and the graduate project 1 course will be. In Unit 1, there's an intense 5-week human anatomy course. And this course is going to build on undergraduate level anatomy with a more clinically focused look at the human body. You're going to have 5 days of lecture and 3 days of lab in human anatomy, where you will use the sector table, which is the 3D virtual cadaver lab, and then actually go into the gross anatomy or the cadaver lab for dissection. Also in Unit 1 is a diagnostic science course. Now this course is an introduction to radiographic and laboratory methodology. And you're going to need a basic understanding of these methods throughout the year in clinical medicine and PBO and PATM. And this course gives you an introduction to radiographic imaging, how X-rays are developed, and CTs and MRs and ultrasound and the different methodologies behind it, as well as some of the lab studies that you need to be familiar with. And so that's Unit 1. It's the first 5 weeks. It's very intense. In Units 2 through 4, the courses are all designed to align, with some exceptions, based on organ systems. So what that means is, the basic science course, it's going to teach you about the physiologic and pathophysiologic processes pertaining to a specific organ system. In clinical medicine, it's going to look at the disease process, the etiologies, epidemiologies, presentations, which a differential diagnosis list might look like, and how to do diagnostics for that disease process, and then the treatment of these diseases. Pharmacology is going to cover pharmacologic interventions. The PATM course, the patient assessment diagnostic methods, is going to teach assessment methodology within each organ system. And then problem-based learning brings it all together in an application course where you're going to apply the knowledge and skills that you learned throughout the curriculum in practical patient care situations. And so if, for instance, in Unit 1, we begin with hematologic disorders. So the hematologic system. In basic science, we're going to learn about the physiology of blood products, the pathophysiology of diseases pertaining to those things. In clinical medicine, you would learn different disease processes like your leukemias and your anemias and all the coagulopathies and those types of things, how they would present, who would get them, how you would treat them. Pharmacology would go into the pharmacologic interventions. Patient assessment would look at what exams would I do for these patients. And then in problem-based learning, we might do some case scenarios where you would put all of this information together. And so that's units 2 through 4. And then in unit 5 is the clinical year prep, where we do a lot more hands-on and procedural medicine, and the graduate project, where we'll start looking at research and evaluation of research, and beginning the master's thesis process. So over the next couple of weeks, you should be receiving a list of textbooks via email. Most of the textbooks you can access through the online platform Access Medicine, which is a McGraw-Hill platform that the program has access to, and you will have access to throughout the program. Many of the textbooks are accessible there. There are some that you may have to look at purchasing that are not available online, and some of those books, again, will be on the list of textbooks that's available, and throughout the orientation process, we'll also talk about textbooks. Now, I'm sure many of you are wondering what a typical PA school week looks like. It's pretty much Monday through Friday, 8 a.m. to about 3:30, 4 o'clock in the afternoon is what you should plan on. Now, that's not always the case, but we like to have you prepared to do 8 to 4 Monday through Friday. Depending on the unit we're in and the day of the week, that might be a little bit more flexible. There is a lunchtime that's scheduled in your day, so you'll be able to eat lunch. A lot of students will bring their lunch, and we have a student lounge that is specific for just PA students, where you can store your food and prepare it, or there are places nearby that you can get lunch. Now, Monday and Wednesdays, you'll have a little bit more of a flexibility in your midday, because Mondays are set up as advising time as needed. The time is blocked in the schedule on Mondays. And on Wednesdays, there's time that's blocked for an optional chapel attendance. Should you choose to attend the chapel services on campus, that time is blocked in the schedules. Fridays, we typically will end well before the 3:30, 4 o'clock time frame. However, we do allocate time in the afternoon that can be used at the discretion of the program director. So there might be an occasion where Friday afternoons is necessary, but I know the program director tries to limit that so that Friday afternoons are a little bit more open. So I'm sure that this didn't answer all of your questions. It's just a brief introduction to kind of the didactic year. If you have more questions before you get here, please feel free to reach out to Jessica Morris as your point of contact. And otherwise, I'll see you in January. We look forward to having you here.